Patient is 16 years old and student at high school, complains of very severe jaw pain for several weeks. The dentist diagnosed slightly crooked dentition. The X-ray showed that the third molar teeth on both sides of the lower jaw did not have enough space in the jaw and recommended the removal of the wisdom teeth. The patient wanted to wait until after her exam in 4 weeks for this procedure and was looking for pain-relieving options until then. She also wanted to be able to relieve the stomach and upper abdominal pain as well as menstrual cramps. In my office, taking a case history, I found the left side of the face shows a hard muscle tension, which leads to a slight déplacement of the jaw. On the meridian chart, you see the stomach, the small intestine, and the gallbladder meridian. Among the symptoms listed, jaw pain, headache and hip pain, stomach burns and upper abdominal pain, heavy menstrual bleeding with high blood iron loss, and irritable bladder. For the last 1.5 years, the patient has been experiencing the separation of her parents, and it is difficult for her to decide with whom she would live. In addition, she must pass important school exams. The patient was born on the 30th of the month and on a Thursday. I explained to the young patient how her body processed all this, because feelings are expressed through organ functions. Lower jaw has a relation to the hip, as well as upper jaw to the shoulder. The hip provides a kind of anchor to the legs, like a safe place for the legs to move. Mental blockages hinder progression and can cause hip pain. Abdominal organs such as kidneys, intestines, bladder, uterus, and so on also have their place in the pelvic area. Along the lower jaw stretches the stomach meridian, father of well-being. Patient felt very stressed and unwell for many months. The gallbladder energy pathway has a strong effect on the jaw joint. Anger, especially indecision or insecurity, causes stress in the body. The small intestine meridian reacts to existential person-related worries, restlessness. When there is tension or stress, the energy pathways react with increased muscle tone. The muscle around these energy pathways contracts, causing the jaw and facial muscles to contract. This can also lead to trigeminal neuralgia. The stomach burning and upper abdominal pain are common accompanying symptoms of gallbladder and stomach dysfunction. The urinary bladder indicates the ratio of power one has to one's emotions. Each tooth is associated with an organ in the body. Pain in each tooth can predict problems in certain organs. The wisdom teeth, the third molars, are associated with the heart and small intestine. When the young patient became aware of her parents' separation, it broke her heart emotionally. Also, the constant headache searching for a solution for her parents burdened the emotional brain as abdominal brain, the digestive tract. All symptoms together correspond to the picture of CMD, the CranioMandibular Dysfunction known as Temporomandibular joint. Basically, everyone can be affected by the clinical picture of CMD, from small children to the elderly. In my opinion, the possibility of developing CMD should always be considered in connection with jaw pain and headache among children and adolescents. The causes of CMD are unknown. However, if the stomach, the small intestine, the gallbladder is taken into mind in their physical as well as psychological function in case of jaw pain, medications or even surgical interventions can be reduced or even prevented. Persons born on the 13th or 31st of the month internalize the father-mother-child relationship as an essential family identity. Without this identity, the person falls into emotional suspense because it doubts its own identity due to the lost Trinity. Born on a Thursday is a truth seeker. It reinforces the bringing force of truth and helps to transmit active, continuous healing to humanity in its perfect power. It senses the lack of authenticity as well as the unhappiness of others and misses needs of its own. Saturated by the concern of others, it comes into conflict with itself, so the person chews on various life issues non-stop. In this mental carousel, the person cannot find the right decision. The psychological function of the gallbladder is to digest the sharpness of life, anger, rage, through decisiveness. Homeopathic remedies and mother tinctures, as well as minerals and vitamins and even amino acids and enzymes, have a psychological effect on the cells of the body and bring a change of mind. Yarrow with millefleur as mother tincture best fits the symptoms described above. The minerals potassium and copper contained in it supported a physical and psychological healing process. Potassium has the psychological function of balancing ignorance of one's own needs. Copper has the psychological function of transforming dependence and leaning from feelings of weakness. The patient was able to deal with the situation better. She is now 20 years old and has not had any of the wisdom teeth removed.